Kerala, a small southwestern state in India, comprising merely 1.2% of the country's land area and 2.8% of its population, has emerged as a remarkable case study in human development that challenges conventional wisdom about the relationship between economic growth and social progress. With a per capita income significantly lower than many Indian states, Kerala has achieved social indicators comparable to developed nations, creating what scholars term the Kerala model, a development paradigm that prioritizes human welfare over pure economic metrics. This analysis examines four interconnected pillars that have transformed Kerala into India's most socially advanced state: radical poverty eradication, revolutionary healthcare reforms, transformative women's empowerment through Kudumbashree, and groundbreaking participatory governance through the People's Plan. Together, these initiatives represent not merely policy interventions, but a fundamental reimagining of the state's role in human development. Kerala's poverty eradication achievements represent perhaps the most dramatic social transformation in modern India. The state has achieved a poverty rate of just 0.71%, the lowest in the country, while the national average hovers around 21.9%. Even more remarkably, Kerala houses the Kottayam district, which has achieved the distinction of being the only district in India with zero poor residents. The trajectory of this transformation is striking. In 2012, Kerala's poverty rate stood at 11.3% compared to the national average of 29.5%. By 2025, the state government aims to completely eliminate extreme poverty, with Chief Minister Pinarayi Vijayan declaring the target date of November 1, 2025, for Kerala to become India's first state free of extreme poverty. The poverty eradication strategy operates through a comprehensive identification and intervention system. The government identified 64,006 families across 1,032 local self-governments as extremely poor, implementing targeted interventions that have already lifted 44,539 families out of extreme poverty, representing nearly 70% success rate within the program's initial phase. The approach transcends traditional welfare by addressing systemic barriers. The program ensures access to essential documents like Aadhaar, cards, bank accounts, and Social Security enrollment, fundamental requirements for accessing government benefits that were previously beyond reach for the extremely poor, according to the 2024 economic survey by the Kerala government. Nearly 50% of targeted families were lifted out of extreme poverty within just 2 years of program launch. This poverty reduction strategy creates cascading benefits throughout Kerala's social fabric. Reduced poverty directly correlates with improved health outcomes, increased educational participation, and enhanced gender equity. The success demonstrates that focused state intervention, when systematically implemented through decentralized governance structures, can achieve results that market mechanisms alone cannot deliver. Kerala's healthcare system represents a fundamental reimagining of medical care as a public good rather than a commodity. The state has achieved healthcare indicators that rival developed nations. Infant mortality rate of 7 per 1,000 live births, as compared to India's 30, maternal mortality ratio of 19 per 100,000 live births against India's 103, and life expectancy of 75 years compared to India's 69.7 years. The system's foundation rests on universal access principles. Kerala operates a 3-tier healthcare structure combining primary health centers, community health centers, and district hospitals, ensuring no citizen is more than 5 kilometers from basic healthcare facilities. This geographic accessibility is complemented by financial accessibility. Through comprehensive insurance coverage and subsidized care, unlike many states that have witnessed healthcare privatization, Kerala has strengthened its public healthcare system while strategically integrating private sector capabilities. The state government invests approximately 4.2% of its budget in health, significantly higher than most Indian states. This investment has created a robust infrastructure capable of handling complex medical procedures, while maintaining affordability. During the COVID-19 pandemic, Kerala's healthcare system demonstrated exceptional resilience. The state maintained one of India's lowest fatality rates through rapid testing, contact tracing, and community health worker networks. The integration of traditional community organizations like Kudumbashree into health delivery mechanisms proved crucial during crisis management. Kerala's healthcare philosophy emphasizes prevention over treatment, creating long-term sustainability and cost-effectiveness. Community health workers conduct regular health surveys, early disease detection programs, and health education initiatives. This preventive approach has resulted in significantly lower rates of lifestyle diseases and communicable disease outbreaks compared to other Indian states. The state has already achieved the United Nations Sustainable Development Goal 2030 targets for neonatal mortality rate, infant mortality rate, under 5 mortality rate, and maternal mortality ratio, 5 years ahead of schedule. This achievement positions Kerala as a global exemplar of how systematic public health intervention can achieve developed world outcomes within developing world contexts. Kudumbashree launched in 1997. It's evolved into the world's largest women's empowerment network, encompassing 4.8 million women across Kerala, representing virtually every woman in the state between ages 18 and 65. The organizational structure operates through a 3-tier system: 317,724 neighborhood groups (NHGs) at the grassroots level, 19,470 area development societies (ADS) at the ward level, and 1,070 community development societies (CDS) at the local government level. This structural design ensures representation from Kerala's most marginalized communities. Kudumbashree's membership is specifically weighted toward women from below poverty line (BPL) families, scheduled castes, scheduled tribes, and other socially disadvantaged groups, making it not merely a women's organization but a platform for intersectional empowerment. Kudumbashree operates as a comprehensive economic ecosystem, generating sustainable livelihoods for women members. The network manages microfinance operations with a portfolio exceeding 15,000 crore, providing collateral-free loans to women entrepreneurs. The repayment rate consistently exceeds 95%, demonstrating both the financial discipline of members and the effectiveness of peer support mechanisms. The organization has diversified into multiple economic sectors: agricultural production and marketing cooperatives, manufacturing units for consumer goods, service sector enterprises including catering and cleaning services, and technology-enabled businesses. During the COVID-19 pandemic, Kudumbashree members pivoted rapidly to manufacture masks, sanitizers, and other essential supplies, demonstrating the network's economic agility and social responsibility. Beyond economic empowerment, Kudumbashree has fundamentally altered gender dynamics in Kerala society. Research demonstrates that participation in Kudumbashree activities correlates with increased decision-making authority within households, greater political participation, enhanced leadership skills, and improved access to public services. Women who join Kudumbashree report significant improvements in self-confidence, social mobility, and community recognition. The network serves as a training ground for political leadership. Many Kudumbashree members have successfully contested local government elections, with the organization providing both skill development and peer support networks necessary for political participation. This has contributed to Kerala achieving one of India's highest rates of women's political representation at the local government level. Kudumbashree's success stems partly from its strategic integration with government, poverty alleviation, and development programs. The network serves as the primary implementation mechanism for rural employment guarantee schemes, skill development programs, and financial inclusion initiatives. This integration creates efficiency gains while ensuring that government resources reach intended beneficiaries through community-controlled mechanisms. Kerala's People's Plan campaign, launched on August 17, 1996, represents one of the world's most ambitious experiments in participatory democracy and decentralized governance. The initiative emerged from a recognition that top-down development planning, however well-intentioned, failed to address local needs and priorities effectively. The campaign was inaugurated under a 400-member advisory committee headed by EMS Namboodirapad, with broad political consensus across party lines. The conceptual framework rests on the principle that development priorities should be determined by those most directly affected by development outcomes, rather than bureaucrats in state capitals or national planners deciding resource allocation. The People's Plan transfers genuine decision-making authority to local communities through their elected representatives. The People's Plan operates through Kerala's three-tier local governance structure: 978 gram panchayats, village councils, 152 block panchayats, intermediate level, and 14 district panchayats, complemented by 60 municipalities and 5 corporations in urban areas. This creates 1,209 local government units with genuine planning and implementation authority. The most revolutionary aspect of the system is the devolution of financial resources. The Kerala government transfers 35 to 40% of the state's developmental expenditure directly to local governments, giving them discretionary authority over budget allocation. This represents approximately 25,000 to 30,000 crores annually, resources that local communities can deploy according to their identified priorities rather than predetermined state or national schemes. The People's Plan employs multiple participation mechanisms to ensure broad community engagement in development planning. Gram Sabhas, village assemblies, serve as the primary democratic institution, with constitutional mandate for quarterly meetings where all adult citizens can participate directly in budget discussions, project evaluations, and policy decisions. The planning process follows a structured annual cycle: data collection and need assessment, priority identification through community consultations, project formulation with technical support, resource allocation through democratic voting, implementation through community monitoring, and evaluation with citizen feedback. This cycle ensures that development projects reflect genuine community priorities rather than bureaucratic preferences. Special provisions ensure representation of marginalized groups, including women, scheduled castes, scheduled tribes, and economically disadvantaged families. Women's participation is particularly emphasized, with mandatory gender budgeting requirements and specific allocations for women-centered development initiatives. The People's Plan has achieved remarkable outcomes in democratic participation and development effectiveness. Over 3 million people participate annually in Gram Sabha meetings, representing one of the world's highest rates of direct democratic participation. Projects implemented through the People's Plan demonstrate higher completion rates, better maintenance, and greater community ownership compared to centrally planned initiatives. The system has been recognized globally as a model of democratic governance. The United Nations, World Bank, despite its imperialist nature, and various international development organizations have studied Kerala's experience as an exemplar of successful decentralization. The model has influenced policy discussions on participatory governance across the global South. Despite its successes, the People's Plan faces ongoing challenges, including capacity-building needs at the local level, coordination between different tiers of government, and ensuring adequate technical support for complex projects. The system has evolved continuously to address these challenges, incorporating digital technologies for citizen engagement, improving training programs for elected representatives, and strengthening accountability mechanisms. Kerala's social advances cannot be understood as isolated policy interventions, but rather as an integrated system where each pillar reinforces and amplifies the others. The Poverty Eradication Program operates through local government structures created by the People's Plan, implemented by women's collectives organized through Kudumbashree, and supported by universal healthcare access that prevents medical expenses from pushing families back into poverty. This systemic integration creates multiplier effects that exceed the sum of individual programs. Women empowered through Kudumbashree become more effective participants in People's Plan processes, leading to more gender-sensitive development priorities. Healthcare improvements reduce household economic stress, enabling greater participation in economic activities facilitated by Kudumbashree. Decentralized governance ensures that poverty eradication programs address locally specific needs rather than applying uniform solutions. Kerala's transformation has been facilitated by remarkable political continuity and social policy priorities across different governments. While electoral politics remain competitive, there exists broad consensus across major political parties regarding the importance of social development, women's empowerment, and participatory governance. This consensus has enabled long-term institutional development that transcends electoral cycles. The Communist Party of India, Marxist, and Indian National Congress, the state's two dominant political formations, have both contributed to and benefited from Kerala's social development model. This bipartisan commitment to social progress has created policy stability that enables long-term planning and implementation. Kerala's model offers crucial insights for global development discourse, particularly the ongoing debate about inclusive growth and sustainable development. The state demonstrates that it is possible to achieve high human development indicators without correspondingly high per capita income. Challenging orthodox economic development theories. The model's emphasis on participatory governance provides lessons for democracies struggling with citizen disengagement and political alienation. Kerala shows that meaningful citizen participation in governance is achievable when supported by appropriate institutional structures and genuine resource devolution. Kerala's social advances constitute more than successful governance. They represent the most sustained contemporary experiment in applying Marxist-Leninist principles within democratic constitutional frameworks. Under Communist Party leadership, the state has demonstrated that socialist transformation remains both theoretically coherent and practically achievable. Even within the constraints of federal parliamentary democracy and global capitalist integration, the four pillars examined: poverty eradication through class-conscious intervention, healthcare decommodification, women's collective empowerment, and participatory planning demonstrate what Gramsci called war of position, the patient construction of alternative institutions that prefigure socialist social relations. While challenging capitalist hegemony from within existing structures, the Communist Party's approach validates key insights from the democratic socialist tradition while maintaining revolutionary objectives. By treating state power as a site of class struggle rather than neutral administrative apparatus, the party has created what might be termed socialist governance, using bourgeois institutions to advance proletarian interests while building mass organizations that strengthen working-class political capacity. As Kerala approaches complete elimination of extreme poverty, the state stands as proof that an alternative world remains possible. In an era when global capitalism faces mounting contradictions, environmental crisis, rising inequality, democratic decay, Kerala's experiment demonstrates that conscious political organization guided by Marxist theory can create conditions for human flourishing that transcend market logic. The challenge for international socialist movements lies not in mechanically copying Kerala's specific policies, but in understanding the underlying method. How to combine theoretical clarity about capitalist exploitation with patient institutional work that builds popular power while prefiguring post-capitalist social relations. Kerala shows that the long march through institutions, when guided by revolutionary theory and sustained by mass organization, can achieve transformations that seemed impossible under capitalist hegemony. Through systematic analysis of these four interconnected pillars, we see that Kerala's transformation represents neither social democratic reformism nor revolutionary socialism, but something qualitatively different. Democratic socialist transition achieved through patient ideological struggle and institutional innovation. This provides hope that similar transformations remain possible elsewhere, given adequate theoretical preparation, organizational discipline, and commitment to treating socialism not as distant utopia, but as practical political project achievable through sustained collective action guided by scientific understanding of social development. It is possible to deepen the discussion under socialist theoretical frameworks, to understand how much the concrete direction of the experience in Kerala actually relates to a revolutionary struggle or not. But what matters most at this moment is the struggle to overcome capitalism is alive. Contrary to what Fukuyama stated, history is not over. The history of the world is the history of class struggle. What do you think? Don't forget, like the video and subscribe the channel to keep thinking the world how it really is.